So Rossella, you've just come back from Sierra Leone. You spent the past 6 months there. Can you tell us what the situation is like today?
Well, it's much better than compared to last October when I arrived in Sierra Leone. At that time, you still had people dying unattended on the streets, not enough beds to take care of all the new cases. The numbers reached up to 100 cases per day in November, December. Now the situation is much better. There has been a huge amount of work put in place both at national and international level. The outbreak is not over. There are some hotspots in the country that are closely monitored, particularly in the capital area, in Freetown, and in the surrounding region. But we can say that the outbreak is much more under control now compared to the past.
So you've just mentioned these 3 hotspots that are, still very active around and in the capital. Can you tell us why they're still like a breeding ground for Ebola?
It's a disease that is very much related to the social life of the communities. One of the easiest way of transmission, for example, was burial ceremonies, because the corpse, the dead bodies, are very much infectious, and the rituals that were put in place in Sierra Leone exposed a lot of communities to the infection. So it's very difficult to get it under control because it implies a lot of changes in the behavior of the people, and this is of course very, very difficult. We just had a patient who arrived in our hospital 2 days ago, unfortunately too late, and he was coming from one of these hotspots, but he managed to leave the quarantined area and move to his family, which was by coincidence living next to a hospital. But the end result was that also the area where his parents live went under quarantine because of course there was cross-contamination.
And you talk about these difficulties you are facing as an aid organisation that's been on the ground since 2001. But what kind of difficulties is Sierra Leone as a country? What kind of difficulties is Sierra Leone's government facing today?
Well, Emergency has been working in Sierra Leone since 2001. And for many years, particularly in recent years, we were trying to advocate to allocate resources and to invest on the rebuilding of the health system, but the attention was really not on these issues, because there was Sierra Leone was developing in terms of economics, particularly because of the mines, a lot of foreign companies that were investing in the country, but then reaching levels of economic growth of 12–13% per year. But this never turned into a real development for the people. And the weakness of the system, I think, has been really evident now. And fortunately, it seems that the international community at large and the government of Sierra Leone are now trying to focus on proper planning and rebuilding of the health system at all the different levels, from primary health care to secondary and tertiary health care, and the training of the health personnel, because the capacity building, of course, is something quite important. But I mean, if you think that as soon as Ebola hit the capital, most of the hospital, private and public hospital in Freetown, which is a 1.5 million city, shut down because they were not able to prevent the infected patients to enter the hospitals, and the situation was really a disaster. Our surgical and pediatric hospital in Goderich has been the only facility that never stopped the clinical activity all through the outbreak. For 50 days, our 16 pediatric beds were the only available beds for children in the entire capital. So the system has been really under stress, and it has to be rebuilt from scratches.
I've been speaking to MSF, Médecins Sans Frontières, who's also been battling Ebola on the ground in Sierra Leone. And one of their main warnings at the moment is that some of their aid workers and population on the ground as well have been showing, I'd say, being a bit more lax in terms of prevention measures that were implemented at the beginning of the action on the ground. And I'm talking about closer contact with the sick people. Is that something you are facing as well as an aid organisation?
Well, this is one of the issues, of the hot issues at the moment. There's a lot of work and discussion in terms of implementing infection prevention and controls measures also now, mainly in health facilities. But the real problem is that it's not just a matter of protecting the hospitals. You should really take care of the entire life, of the normal life of the people. Just to give you an example, for all these months, wherever wherever building you entered in Sierra Leone, they were taking your temperature, and you had to wash your hands with low chlorine water, with chlorinated water. As soon as the numbers of the outbreak decreased, back in January, you could easily see that the chlorine bucket started to disappear and the people were not taking temperature, and then we had a spike. So this is definitely something that is quite dangerous. Fortunately, Ebola disease is not airborne, so in order to get the disease, you really need to have a close contacts with body fluids of someone who is infected already and has already developed the symptoms. So this is something that helps quite a lot, but at the same time you really need to make sure that all these infection prevention measures are in place at every level of the normal life if you want to get rid of Ebola, because the risk is that the disease becomes endemic, and that is going to be a big problem.
So as you said yourself, the focus will be on rebuilding infrastructure, and in Sierra Leone, if that's not done properly, if the media frenzy dies down and the world kind of forgets about this country that's today in ruins, you said yourself, the next disaster could be next door. What do you mean by this?
Well, I think that nobody was really, when this outbreak started, nobody was really expecting it to hit so hard and so largely. And nobody was really prepared. The local governments, the WHO, but also the NGOs was something completely new. I think that there's a lot of lessons learned from this outbreak, and if the proper attention is still paid to this issue, there are good chances that the next one will not see the same huge amount of deaths, and that many more lives could be saved. But of course, it's a long process, and as you know, there are so many new emergencies coming in, and media, people attention is driven away. But what is important, I think, that at the health community level, nationally and international, the attention is there, and these lessons that we are learning are not lost.